Hi, this is Dr. Ari Branch in Dallas, Texas. Since 2002, we've treated people primarily using our website at www.absolutelythin.com with a medical approach, generally using a combination of hunger suppressant medication called phentermine with a small amount of Prozac to help people control their overeating, resulting in overweight, weight gain, and obesity. Our medication helps control hunger and overeating. We also treat people for healthy weight maintenance. If you'd like additional information about our program, please put your name and your email address in the forms below. Click the Submit button. You'll receive a detailed email information about our program and how to enroll, as well as contact information. Often when I'd see patients, typically women, but we see a fair number of men also. In discussing with them why they were here to see me, I'd often ask, well, why are you here to see me? And they'd say, well, they were here for problems with their weight. I'd ask, have you seen other programs or done other programs? And often the answers would be yes. And I'd say, well, what other programs have you done? And I'd say, well, we've done Jenny Craig, we've done Weight Watchers, any number of other programs. And I'd say, well, how do they work for you? And they'd say, well, it just didn't really work that well, or it did for a while, but has not succeeded in long-term weight loss and maintaining that weight loss. I'd say, well, what seems to be the problem? And there was a phrase I was always looking for, which would usually pop out next, which was, I don't know. I eat healthy. And I'd often respond, you eat healthy? And the patient would respond, well, yes. And I'd say, well, how much do you eat? And it was often like looking at a deer caught in the headlights. They'd never really thought about that. So it's really much more important how much you eat. And this is often, usually, always determined by your body type. And also there's a difference in men and women. You need to know what a factor, there are two factors actually. One is called your body mass index, or BMI, which tells how your weight compares to others in the population, as well as what's called your basal metabolic rate. And there are calculators all over the internet for how to calculate that. Generally, men are larger and more muscular, and in calculating their body basal metabolic rate, it'll tell how many calories a day they need to consume in the way of food to keep their weight constant. The reason basal metabolic rate is important is that if you eat more than what is a normal basal metabolic rate as is calculated, and again, if you'll just Google the phrase BMR calculator, in any Google search, it'll pull up links to zillions of calculators all over the internet. I usually recommend you try 2 or 3 just to make sure you get some ideas to what your basal metabolic rate is. What that means, and it's often also referred to as what's called the resting basal metabolic rate. It means that without exercise, that you need to eat that number of calories to keep your weight constant. It follows that if you eat more than that number of calories per day, your body converts it into body fat, and it's stored, I like to think of it as like a fat bank in your body where you've made deposits. The only way that you can lose weight is to consume over a period of time fewer calories than is your basal metabolic rate. There are about 3,500 calories in a pound of stored body weight. What I would typically do is if someone has a BMR of 1,500 calories a day, recommend that they eat no more than 1,000 calories a day, which means that they're subtracting about 500 calories a day from their weight. It works out nice and evenly that if you divide 500 into 3,500, which is the number of calories in a pound of stored body fat, you come up with 7, which means you'll lose about 1 pound a week. To keep from being hungry, we've also found that a proper dose, and we customize your dose using a combination of phentermine, which is a well-known, extremely safe anorectic or hunger-suppressing prescriptive medicine that you get at the pharmacy of your choice, usually with a small amount of Prozac, which is being used in an off-label manner and has been demonstrated to enhance the hunger-suppressing effect of just phentermine alone.